Causes of low breast milk supply. You may be asking yourself, why is my milk supply low? And you may be thinking that there are specific signs you should be looking for that indicate when your milk supply is decreasing, but there aren't. Instead, there are specific factors that can result in your breast milk supply decreasing, including the following. Your baby not latching or positioning properly. If your baby isn't getting the nutrition they need, it's more likely to be because of improper latching, which may reduce the production of milk. Changing breastfeeding positions may help improve the latch. Waiting too long to start breastfeeding. Ideally, it's best to start breastfeeding about an hour or so after giving birth. Not breastfeeding often enough. Experts recommend breastfeeding your newborn about 8 to 12 times a day. Not pumping enough. Pump more often to produce more breast milk. If you can, pump both of your breasts at the same time for 15 minutes every few hours. Pressing on your breasts gently during the pumping can also help with emptying. If your baby doesn't finish a breastfeeding session, be sure to pump the remaining milk from your breast. Introducing a bottle too soon. Sometimes babies can get confused or lose interest in feeding at the breast after introducing bottle feeding. If this happens with your baby, try breastfeeding on demand. Supplementing with formula. Feeding your baby with formula may reduce their demand for breast milk. Instead of supplementing with formula when you're apart, pump and store extra breast milk in the freezer for future feedings. Try not to skip pumping sessions even if you're at work. Your baby starts weaning earlier. Some babies naturally wean themselves from the breast sooner than others, especially when solid food is introduced at 6 months old. Being anxious. Stress can affect your release of breast milk, so being relaxed before breastfeeding can help. Try feeding your baby in a dim and quiet room, and try to eliminate as many distractions as possible. Using certain medications, such as those containing pseudoephedrine or even certain types of hormonal contraception. Having had breast surgery. Your baby's birth was premature. If your baby was born prematurely, they may need special care in the coming days, which may prevent you from breastfeeding right away. Having pregnancy-induced high blood pressure. Obesity. Having insulin-dependent diabetes. Not taking good care of yourself. This is easier said than done, but try to eat healthily, drink lots of water, sleep as much as you can, and minimize your stress levels. Smoking and drinking alcohol. In summary, there are many factors that can affect your breast milk supply, including your baby improperly latching, not breastfeeding and pumping enough, waiting too long to start breastfeeding, introducing a bottle too soon, supplementing with formula, taking certain medications, having certain medical conditions, smoking, drinking alcohol, and not taking care of your health, among others.